Hi, my name is George Moniz. I'm one of the podiatric physicians on the foot and ankle team here at Ortho, Rhode Island. As part of my practice for the past 25 years of podiatric medicine and surgery, I'd like to talk to you a little bit about my specialty, that being biomechanics in regards to orthotics and foot and ankle bracing. One of the things I want to discuss, and I hope to make clear, is orthotics are custom braces for your foot that addresses any foot pathology you may have. When I examine you, when you come into my office, I will listen to your chief complaint. I will thoroughly examine your foot and ankle, and part of my exam, which I think is the most important part of the exam, is just watching you walk, where I see your abnormal mechanics. And then what I do is I basically cast you in plaster, and as the plaster is setting around your foot, what I do is I brace your foot in its anatomically correct position. In other words, when the cast hardens and I have your cast ready, you can see here, as this is showing, that the heel is perfectly in vertical with the table, which is the ground, as well as your arch is basically formed. So when I send this orthotic to my lab, which I use Marathon Orthotics, which I think is the best orthotic lab in the country, I work closely with their orthotists, where I prescribe a custom designed orthotic for you. Now, the science and technology behind orthotics have come a long way since those old leather-filled, what I call arch supports. Orthotics can address numerous issues with your feet. For example, this orthotic here is showing you a difference in height, where this particular patient has a leg length inequality, which I'm correcting here with this post. Other orthotics can address severe flat foot conditions, as you can see in this orthotic, which is built up higher in order to control that person's foot. Orthotics have also been wonderful for options for adolescent kids, where we're treating both discouraging in-toeing and out-toeing, as well as very severe flat cases or flat foot cases in pediatric patients. There's all kinds of orthotics that can be designed for your foot depending on what your foot needs. Now, one of the things I want you to understand is when I watched you walk and I basically evaluate your abnormal mechanics, that's what I'm correcting when I brace your foot. So all of these like fancy stores that have these sensors that you can walk on, if you think about this for a minute, you're still walking abnormally over those sensors. So what's that machine going to do? They're going to spit out an orthotic or an arch support, what I call an arch filler, at your size. Yeah, and they'll have ones that are designed for like flat feet, or they'll have some for high arch feet, but it's really not controlling you. Because if you think about it, you're walking abnormally over those sensors. That's what that machine is going to capture. So orthotics are, you need to think of orthotics as custom braces for your feet, and custom designed, which they'll control your abnormal mechanics. So there's other options here at Ortho Rhode Island too. If we find that orthotics are simply not enough for your foot, we do design custom foot and ankle braces that are designed for your feet, which, similar to my orthotic cast, I'll cast your foot and ankle, and then again, I'm bracing your foot in the corrected anatomical position that it needs to be in. So these Ritchie braces, or custom foot and ankle braces, are designed for a more severe correction that we need. Both we can address ankle issues, foot and ankle issues here for severe osteoarthritis. These hinges either come locked or unlocked when we need to control your ankle motion. These hinges also come spring-loaded, where we can address conditions such as a drop foot condition, which these work really well for. And what's nice about these is that most insurances actually cover a portion of these orthotics, and as well as some of these braces. Now this here is what I call my Arizona brace, or my Gortman brace. Now these are, again, custom made to your foot and ankle here, and these are really made for the severe deformities that we see here at Ortho Rhode Island. So Again, if you are not a good surgical candidate, sometimes conservatively orthotics are a nice option for you that we can design specifically for you. So in conclusion, I hope this sheds a little light on what a true custom orthotic is versus an over-the-counter insert. And again, here at Ortho Rhode Island, I hope this educational series finds you and your family well, safe, and healthy. Thank you.